Welcome to the session on literature review for research problem. That means when you have to find a topic for the research, how do you find a research problem or the research topic? You have to do a extensive literature research. Most of the students think it is a problem to find a research problem, but it's not. You have to put certain efforts, time, review the literature, read it, observe it in the clinical area, and you have to do the discussion with your seniors. What are the sources of the research problem? That means the field or clinical experience. Day to day you are working with the patients. You face many problems and try to find out some solution. So what you can do? You can do a small research to find out a solution. Or you are doing some procedure which is very old procedure, but you think this procedure steps can be modified or some other thing can be done. So what you have to bring in? The evidence through research, data analysis, reports and studies. You have reports, various kinds of reports, and some of the studies are also available related to the patients. Critically, you have to analyze the data and the reports to see what are the gaps, where you can do the study to find out some evidence. Next is your case studies, patient studies, journals where case studies and the, you can say, patient scenarios are being published. You can go through the journals, read the abstract, read the study, read the recommendations. See what recommendations they have given for the future. So you can find even your problem from there. But you should have some research area in your mind. Your thesis and dissertation. Previous research is done by your MSc students, B.Sc students, PhD, your doctors. So many theses and dissertations are available in the library. You go to the library or online in the Shodh Ganga, there are theses are available. Go through those theses, the discussion chapter, the recommendations, the abstract. You will find where are the gaps which further needs the evidence. Discussion among the professionals in your field. Maybe your nursing professionals or interdisciplinary discussions which will help you to identify some of the areas. Health and social issues. There are so many new health problems are emerging. Patient experiences are different. Utilization of services may not be there. Maybe some social problem is there. So take up some issue. Review the literature. Then you can finalize your problem. So literature review is very critical in the beginning because it will help you to find out the gap areas, available evidence and arguments for your new study. Then need and justification for your new study. You just cannot say, I will do study in this area. You have to strengthen your research topic or problem statement with the arguments and justification. And from where this argument and justification will come? It will come from the old studies, thesis, dissertations, your observations, case studies, data. So you have to justify. Even the research questions and hypothesis. What research questions and hypotheses you will write for your study, objectives and methodology of your study. When you read various studies, you are aware that what previous researchers have done, what methods they have used, what was the sample size, what was their sampling technique, what was their approach, what problems they have faced. And what I can do, what are the tools which they have used, what were the items in the tools. So you can get an idea and plan a research. What is the purpose of literature review? That means you will sum up what is known. That is foundation for the new study. It will help you to justify, help in formulating research questions for your study. You review the methodology, then you suggest methodology for your own study, and interpretation of findings again help you to find out the gap areas. It will also help you to use, data analysis. It will be tools what you will use. If they have done any pilot study, what was the problem in the pilot study? You can plan. You can assess what were the issues which previous researchers have faced. So, these readers should know whatever you are writing, your readers need to be convinced that current knowledge about the topic is not adequate. Why you want to do new study? Where is the gap area? Significance of new study, what will be the benefit of the new study? Argument for the new study. So, two type of sources are available, primary and the secondary. Primary means the researchers, first-hand research done by the researcher is known as primary research. When they give references in their research from different studies which others have done, so you will review, search those studies, they are known as secondary sources. So, review must start with the question. Some question must be there in your mind. When you are working in a clinical area, you have observed something and it disturbs you that I want to find out a solution for this problem. So, some question will be there. Researcher collect and analyze and interpret the findings from different studies, summarize those studies. Then they analyze why I want to do a new study. This is the gap area. This will be the benefit or risk to the patient. But the review has to be updated. It should start with the latest literature available. That means if you want to do study in 2023, the research review should start from 2023 and go back. Because nowadays the life of evidence in the health sector, they say, is not more than 5 years. Only in the exceptional areas you can take old studies. Exceptionally, some areas where very few studies are being done. So let us see, the literature review has systematically to be done. It's not that haphazardly you will say, let me go to the library and do some literature review. No. First you should have question in your mind. What will be your inclusion criteria, exclusion criteria? Review what you do. If the same review some other person needs to do, they should also be able to get the same findings or analysis. So you should have a strategy to locate the relevant studies. Good search skills are important. It needs time and effort. You should know from which site you want to go and search, from which place you will get good thesis or the good journals, or like PubMed is there. Maybe first you will start from the PubMed. Identify the footnotes and citations which are given in the thesis or the studies, and you will go back and study those related literature. Then delimit your search, maybe number of years you want to study for 2013 till 2023, or you want to see only English language studies. So you have to delimit your maybe time period, maybe language, maybe the independent variables, somewhere you have to. Otherwise, there are thousands of studies available and you will get confused. Next is if we see database access through computers. Nowadays, it's very easy. During our time, we used to go to the libraries, take the help of the librarian. They used to give us the abstract. We used to sit there and make notes. But nowadays, access through computers is very easy. But again, you should have those skills to search. On-screen support is also available. They are very user-friendly. Menu are available where you can just put in the options and you will get the studies. Even you should use the tutorials which are available on the sites. Then you should have the familiarity with the softwares, or you can take the help of the librarian or someone to search it. Restrict, already I have told you, maybe independent and dependent variables, or you can combine the variables and search the studies. Next is identify the key words. That's what I am saying. Maybe some of the variables like smoking and cancer. Maybe breast cancer and the stress. Whatever you want to study. Qualitative studies, there are independent and dependent variables. In quantitative studies, there are dependent and independent variables. In qualitative study, there is a phenomena or there is a population. So you have to identify certain words. Sometimes it may take long time for you also to understand what I want to study. What will be my problem statement? Don't get depressed or demotivated. You discuss with your colleagues, discuss with your friends, search the literature, make summaries, review it, critically analyze it. It's a normal process with everyone. All of us face the same issues. Sometimes what I can say, I go through these studies. Oh, it's very easy. Let me take cancer and smoking. But there are thousands of studies available. What I want to do with cancer and smoking? Something new I have to find out. If I feel there has to be some intervention, search that intervention. There must be some study which is available or someone has recommended. So, search that gap area. Be vigilant to search the gap area. Within the broad topic, there can be many research problems. Research problem is an area which needs an answer. Researcher find out a specific research problem and identify one topic which needs a solution. Select a topic, but it is a very creative process. You have to be very creative when you select some topic. Critical thinking about the problem, gap areas and arguments. So best way is write down all your ideas, the broad areas, then select 2 or 3 topics, go through the literature, again you sit, critically analyze, then you select one topic, make a problem statement, then do an extensive literature review. But your literature review has to be related to the final problem and the problem which needs a solution, which will be useful for your department, which will be useful for your hospital, which will contribute for patients' quality care or for some procedure change or for making some policy. So you have to think of a problem which will be useful. Then you have to strengthen that problem with the arguments and justification. I hope this will help you to understand why literature review in the beginning is important extensively. And side by side, when you make a notes, it will help you to go back and review. Searching again those journals are very difficult. So when you go to a library, take your copy, pen, side by side, note down the journals or the references and make small summaries. Let us see research topic. Once you select a broad area, narrow down the problem, finalize after topic the problem statement. Good problem statement should be well structured. So you have to answer certain question, problem identification. What is wrong with the current situation? Why I want to do research in this area? What is the context of the problem? So why? Justification. Scope of the problem. How big is the problem? How many people are affected? Will it be useful to spend so much of time and efforts? Consequences of the problem. What is the cost of not solving the problem? How patients are affected? How quality of the patient care can be improved with this problem solving? Knowledge gap. What information is lacking? Or what has changed over the time? What new I will be bringing in? Propose solution. How will new study contribute to solution to solve the problem? Will it be cost effective? Will it be acceptable to my department? Will they help me to implement it? Will it be useful to my patients and to my institution? Researcher convert the research problem into problem statement. Explain the need of the study, giving justification, developing an argument. So these three things are very important. The broad topic, problem statement, from the literature review, the argument and justification should come, and justification can also come from your own observation and even from data analysis, what you do through the your reports and the case studies. So, researchers select a topic or a phenomena. Depends on qualitative or quantitative study. Maybe one of the example can be side effects of chemotherapy during cancer treatment or side effects of radiotherapy during cancer treatment. Or there is high level of stress among newly diagnosed cancer patient. These are the common problems you must have observed. So you want to do some study on this. Researchers select a topic or phenomena, maybe music as a complementary therapy. Suppose they want to study music as a complementary therapy to reduce the stress of a cancer patient. So these are some of the examples I am just giving you, like side effects of chemotherapy, the research problems. What you have seen is there is nausea, vomiting, loss of appetite are common side effects of chemotherapy, and available interventions are not very effective. Your patient is not comfortable. They are complaining that treatment is not effective. Maybe psychologically they feel that. So you have to find out. Therefore, you will see what new intervention you can bring in or you can research to reduce the side effects of the chemotherapy, which will help the patient to live a quality life and the side effects can be reduced. High level of stress, feeling of uncertainty, fear, loss of confidence, social isolation, no interest in life, routine activities are affected, interpersonal relationships are affected. So patient is depressed, maybe anxious. So there are many therapies, but their effectiveness no one has seen. Everyone is trying on. Maybe try one therapy. If this is not effective, try second therapy. But what is the impact actually? Where is the evidence? So you want that the patient should get one therapy which will have good evidence and reduce the stress. Maybe you want to try a touch therapy, music therapy, or maybe some other therapy. So you will search the literature and try to conduct a study. Purpose of the study: to test the intervention that will help to reduce the side effects of the chemotherapy. You will list down the questions which will help you to collect the data and do the analysis. Hypothesis, in case you are doing a quantitative study, because these are the predictions or about the answers for the questions. Have limited objectives which you are able to achieve within the timeline. So, qualitative study: nature and content of the problem, need information to solve it. In qualitative study, need to generate a theory. In quantitative, you always have a data or information to analyze. Statistically, you prove it. In qualitative, you generate a theory. There is a social problem is taken up. There is a process about experiences or culture that influence the behavior of a patient. So you study in detail. The next part, if you see, is guidelines for critiquing a research problem. Critically analyze. Once you have done all these things, again you say, what is the research problem? Is the problem clearly stated? Does the problem is built on argument for a new study? Does the problem have significance in today's time with the changing time and technology? Will it contribute to nursing practice, administration, or change in education, or change in any policy? Is research problem compatible to the chosen research paradigm and the methods? These questions needs to be answered by every researcher. Very important thing, I think most of you have studied this PICO, that is essential elements of research question in quantitative studies. PICO stands for population or patient or a problem. I for intervention, C for comparison, O for outcome. Remember PICO. Impact of intervention on outcome. Intervention has an independent variable and dependent variable. In population, what is relationship between independent and dependent variable? So your quantitative study will study this. You can see in this table the population, patient and problem. What is the study population? Sample and sampling. Patient with cancer, you can say example. What is the intervention and the treatment? When intervention or treatment is to be given, specify new intervention or new chemotherapy or some other combination of therapies if you are doing. Comparison. What are these for comparisons? That is your alternative therapy or standard procedure, standard care you are going to compare. Outcome. What is the effect of the intervention? Side effects of chemotherapy are reduced or quality of life is improved. So you have make this table when you do some study. PICO elements. It's not important that you will have all the 4 elements. You can have population, intervention and outcome. You can have population, comparison and outcome. Or you can have all the 4 components: population, patient, intervention, comparison and outcome. That is, if treatment intervention you are doing in population, what is the effect of independent variable versus alternative? What you are going to do intervention on dependent variable. If you are studying prognosis in population, does independent variable, that is some disease versus its absence, affect or increase the risk of dependent variable? What is the adverse consequences? If you are studying the etiology of something in population, does independent variable, that is exposure versus non-exposure, cause or increase the risk of dependent variable, that is disease or health problem? So your PICO will help you to answer all these things. Remember, your population or patient, intervention, comparison and outcome may not be available in all the statements. Depend the type of study you are doing and type of problem statement you have created. PICO, how PICO helps in? Clear, specific focus, achievable research questions. All the research elements to be operationally defined for interpretation from researcher point of view. All elements of PICO may not be there in all the research problems. When you have various variables in a study in the problem statement, very important to operationally define these variables. That means not dictionary meaning, but what do you mean by these variables? That is, if you study side effects of cancer and impact of music therapy, then you have to operationally define what do you mean by side effects, what do you mean by cancer patient, what do you mean by music therapy from researcher's point of view, because your operational definitions will be reflected in your tools. Then only you will be able to ask the questions, relevant questions, and your analysis will be much more effective rather than just simply saying, I mean this thing. Critically analyze your operational definitions. Are you able to get the data? Will you be able to get the data what you want? That will help you to answer the questions and to achieve the objectives. The characteristics of the research problem: it has to be novel, relevant, clear, interesting, visible and significant. Something new, something relevant that will help your patient and department. It should be clearly written, not ambiguous. Interesting, that when reader reads or when the committee reads, they feel, yes, this is something interesting you are doing. Feasible, depending on your time and efforts you can do as a single researcher, which have a significance. So we can say, first of all, very important, select an interesting broad area. Again, you have to review the literature. You have to discuss. You have to find out the critical area from the clinical area or from the research findings. Do extensive literature review. That will help you to give justification and argument. Then you narrow down your research topic. When you narrow down your research topic, when you give argument and justification and justify the need, you write a problem statement. Because when it should have a PICO elements, that is your patient, population, intervention, comparison and the outcome, which will help you to write your objectives, hypothesis, help you to write a methodology in detail, what you will do, ethical consideration, what are the tools what you will use and how you will analyze the data. I think this session must have helped you to understand why initially it is important to do literature review, to find out a research problem, research area, which is significant, which is feasible, to solve the problem, to answer the questions, and it will give you a vision how you can give argument and give justification and defend your research problem. Thank you so much. Welcome to the session on research proposal and its presentation. Before we go to the research proposal, it is important to review what are the main 3 steps of doing a research. First, as a researcher, you plan a study. After planning, you implement it. Then you write the findings. So in this session, we will put emphasis on planning. Planning means, first, you identify a broad area of topic. Extensive research review is done. You narrow down a topic. Collect argument, identify the gap area. Collect the justifications and arguments. You write a research proposal. Research proposal, that means, is a detailed plan of study. Every research study should have a protocol or a proposal, and it should be a written one. You cannot say my study is in my brain. No, it has to be written. It has to be written as per the guidelines because it has some purpose. So let us see what is a research proposal or a protocol or synopsis, depends upon the institution what word they are using. Research proposal is simply a structured formal document that explains what researcher has planned. That is your research topic. What is the justification, gap areas, arguments, and the methodology or approach in detail. Research proposal is a concise summary of proposed research. It sets out the central issue or a question that the researcher wants to address or solve the problem. Already I have told you, it outlines the research area, broad area they want to study, what is the current situation or knowledge about it, and the recent debates on the topic. That is very important to understand. You cannot give arguments from the 1940s or 50s. You have to give the recent debates on the topic because you have to give the justification in your proposal. Even your proposal communicates a research problem and proposed method to solve it, and what are the capabilities of a researcher to conduct these studies. Even this proposal is submitted to your research committee to give you approval. After it is being approved by them, your ethical approvals, the same proposal goes. Then if you want some funding from some funding agency, your proposal will help you, good proposal will help you to get the funding also. Research proposal gives a chance to explain the significance of research study to organization which might wish to fund and support your research. It demonstrates quality and importance of study, ability of the researcher to conduct the proposed research. How the ability? Because your proposal will reflect what is your knowledge about the area. What is the knowledge about your research methodology? When you search the literature, give the skill of your search. How much skill you have to critically analyze to find out the argument and the justification and the gap area. So you can see proposal is shared with ethical committee and it is also shared with the administrators of the institutions who will give you permission for data collection. So your proposal have so many important purposes. Let us summarize that. It is a planned document for research. It is a communication tool for others, what you want to do, what is the methodology, what are your justification arguments. It helps to review and monitoring, not by research committee, but even by a researcher. It's a guide for a researcher. What I have to do? If your proposal is approved, if you have worked hard in this stage, your 50% problem is solved. Your proposal will show you a way to move forward, because you have in your mind, what is my methodology, what is my timeline, whom I have to interview, whom I have to meet, from where I have to collect data, how I have to even tabulate the data, how I have to analyze and interpret it. So this initial stage, proposal writing, needs lots of time and effort. I remember when I was writing my PhD proposal, I have to rewrite it nearly about 12 times, because every time I will discuss with my guide, there was something which I left. Go on strengthening. When it was approved in one go, when I submitted the 13th time, it was such a happy moment for me, and it actually helped me. It was a great guide. What I have to do, what data I have to collect, from where, whom I have to meet, from where I have to take permissions, what are the problems and issues which I have to face, what I have to modify after doing a pilot study. Then timeline, when I will complete various steps. So initially, making a timeline along with your proposal is a very beneficial step. So let us go through again some of the purposes. That means writing a research proposal requires a forethought, requires time and effort, understanding of your audience, and creative writing. It should be simple writing, not literature you are writing. It should be simple, clear sentences, what people can understand, what your audience can understand, how you will convince your committees, how you will convince your reader to read it. Better to make a timeline in the beginning. So, writing a good research proposal, read the literature extensively. First, read the abstract. If it is useful, then you read the full study. Don't waste time reading a full study. Read the abstract. Make notes. Note down the references. Students, what they do? I will note down the reference later on. I will come back. No, you will forget. So it is better to maintain a register or maintain a Excel sheet nowadays in the computer, so that when you come back, you know from where you had made this summary, what was the reference. Suppose you want to read again the full study. Note down. There are reference softwares are there. Medley is there, and so many others are there. You can store it. Make note of it. So next is writing a good proposal. Why? Your proposal will help you to get a permission to do a research study. First, your own department will go through it. Then the research committee will go through it. If they give you permission, your ethical committee will go through it, because you are giving all the details in your proposal. You have to strengthen with your arguments from the latest research, which will give them the evidence. Writing a research proposal requires a depth of knowledge and understanding of research area and problem. That is why always select a research area and a problem area in which you have your knowledge and the strength, or clinical area where you have worked. Then only you can have interest and justify, and you can say give a argument for your study, why you want to do, defend your study. This is the reason I have observed in the clinical area. I have observed this patient suffer like this. This will help. I have tried this method and it has actually helped. Now I want to find out the evidence so that it can be implemented with the other patients. So as per guidelines, you have to make a proposal. Most of the institutions have a guidelines for the proposal. Proposal for qualitative study, it is a big challenge. Because in qualitative study, you cannot give a detailed methodology. Why you cannot give? As you collect data, as you analyze the data, the methodology will emerge. What type of data you need more? What type of sample you have to reach out? How you will collect data? But still, what you can give is type of data you want to collect and the methods you will use to collect the data. Researcher needs to convince the reviewer about the topic, its importance and relevance. Researcher is aware of difficulties and challenges in the field. Researcher has skill to solve the problems in the field and data collection. So qualitative studies like ethnographic studies, phenomenological studies, grounded theory, you have to sometimes live with the people. You have to understand their culture, their behavior, their thinking pattern. Why they are not utilizing the services? Why they do not want to go to the health center? What is the status of the women in decision making in the families? Why they do not go for the treatment? Who takes decision for the females or the girl? What is the status of a girl child? There are so many social issues. So these needs qualitative analysis or narrative analysis are also being done. Outline of a proposal. First, most important is the topic. Then introduction of background with the current scenario, importance of topic, benefits of the study. The need. I found most of the students do not justify the need. They do not go in depth with the literature review. But if you are able to give justification, arguments for the need of the study, identify the gap areas, how it will be helpful in nursing, how it will bring in change in the clinical area or administration or education, then your study will be accepted. People will give you permission to conduct the study. Then you have to write the problem statement, identify the variables, write objective. Do not write 10 to 15 objective which you will not be able to achieve it. It's very important to have a limited objectives because you are a single researcher if you are doing. You have a time limitations, you have a funding limitations. So do a study which is feasible, time bound, have selected objectives. If there is any hypothesis, write that. Methodology has to be in detail. What is your research approach and design? Population, samples, sampling technique. You have to be very detailed. You have to explain what sampling technique you will use. What will be your sample size? What are the various tools? Because your operational definitions will help you to make the tools. What methods of data analysis and interpretation you will use? And what will be the benefit to the society? So your research proposal have to be very comprehensive. Written in a simple, clear language without any ambiguity. Write a draft, read yourself, write 4-5 times, do correction, tell someone to read what they are able to understand after reading your proposal. Then you submit your proposal for the approval. And whenever any suggestions are given, take it with an open heart because that is not to criticize you but to improve your proposal. Your thesis advisor, that can be your supervisor, that can be your senior, that can be your guide. Depending on the policy of the institution, sometimes institution gives you a guide and in many places you have the choice to select a supervisor or a guide. Supervisor is an expert in the area, is a mentor, is a critic. They have the time to guide you. They have an interest in the area of the research and helps the researcher to complete the study. So, researcher prepare proposal or protocol in a format and present it. Research committee approves the proposal and gives suggestions if needed. Never take in a negative way the suggestions given. Write down the suggestion. Go back. You yourself first reflect back why these suggestions have come. Will they be useful if I integrate in my study? Will it strengthen my protocol? Discuss with your supervisor and improve your proposal. Review committee need clear idea what the researcher planned to study. Why study is needed? What methods will be used? How and when data will be collected and other tasks will be completed. Whether researchers have the skills and competence. Like during COVID, many researchers have faced problems. The research committee will definitely ask them when they come and present their progress report. What were the problems you have faced? How you have collected data during COVID time? Were you able to get the full sample? What you have decided? Were you able to get permissions? Or what were the issues you faced? So one researcher has to be ready to answer all these questions. So the research committee will evaluate the criteria. What is the importance of your research question? Adequacy of your research problem, timeline, expertise, methodology, and your knowledge. And main important is research problem, gap areas, and arguments. If you are able to convince them, if you are able to defend your research, why you want to do, because this is your baby. You have visualized this. I may interpret in a different way. I may give you 10 suggestions, but you have to give argument why you want to do this. Why only this methodology? Why only qualitative study? Or why only mixed method study you want to do? Why you want to do only in this particular area? So be ready to answer all these questions. They will always judge how much knowledge, in-depth knowledge you have. What are the skills as a researcher you have to identify the problem, to review the literature, critically analyze the arguments, and to critically analyze your justification and the arguments in front of the committees. Then institutional ethics committee. Once you get approval from the research committee, you submit the proposal to the institutional ethics committee. And never start your data collection or anything without the approval of the ethical committee. Even for the systemic reviews, meta-analysis, you need a ethical approval. Now, ethics committee will invite the researcher for presentation. If any suggestions, note down. Even if you need a waiver from ethical approval, still you have to submit to the ethical committee. In India, we follow ICMR guidelines. Latest is 2017 guidelines. These guidelines are applicable to all the biomedical, social, behavioral science research for the health research conducted which involve human participants, biological material or data of the patients. Do not harm the patient. I think we take oath. We always say, do not harm the patient, we will not harm the patient. That is a basic principle even of the research. When you select your participants, most of the people I have seen, they select from vulnerable group. They think they are vulnerable and they will, when they are patients in the hospital, they are under our care, they will not say no to us. But you have no right to force them to be a part of your study. You have no right to harm them. You have no right to say, if you will not be a part of this study, we will stop the treatment or something else. So, the basic principles of justice, harm, and the autonomy has to be taken care of. Why we take informed consent from the patients when we do a study, even from the community people? Because in the informed consent, we write, you have a free will to be a part of this study, and any point of time, even you can leave the study. So they have the autonomy to say yes or no at any point of time. On the other hand, if they are under treatment or if they have any complication due to any intervention under study, still they will get a full treatment. And it's very important to give the compensation to your participants. As per the guidelines, when you write your protocol, the benefits and the risk associated with the study needs to be written not only for your research committee and ethical committee, but also in the informed consent, in the local language, the simple language what your participants can understand. Because deception is not at all allowed, that you may conduct the study without telling them what will be the risk of this study and what are the benefits. Benefits should be equally distributed among everyone, who can afford, who cannot afford. So these are the basic 4 principles. If you remember, as per the guidelines, respect the person autonomy, beneficence, non-beneficence, and the justice. Submitting a research proposal, the research institution will have their own guidelines. Research proposal is submitted for ethical approval. Presentation is done. Ethical committee will review methodology, feasibility, compensation, what you are going to give, maybe monetary or non-monetary, whatever it is. Informed consent, which has to be in English and Hindi. What are the benefits and the risk of the study? And if there is any risk or if there was any side effect, the patient should get a treatment also and can give you suggestions with the approval. Your presentation, very important, make simple, concise, clear presentation. Give important points in the presentation. Keep simple colored scheme. Highlight the important points. Keep time in mind. Importance of study and the gap area and the need has to be given importance. Don't read verbatim. Explain, give in summary what you have written. Present justification and argument through extensive research findings. Some of the students, what they do, they start reading about each and every research finding. You have to make a summary of these findings, then you will present to justify and give the arguments. Objectives to be concise and limited. Methodology should be presented in detail. That means you have to plan beforehand what will be my methodology, how many participants, how I will select them, how I can, you can say, reduce the attrition rate and contamination of, if I am doing in the same hospital, contamination of the sample. If there is any bias, how I will reduce the biasness. If I want to do triangulation or if I want to do cross analysis, how I will do. You have to explain all these things in your methodology. Data analysis, mixed method research, qualitative and quantitative study. Why you are doing mixed method study? To go in depth or to justify your findings and analysis and interpretation. And your references. Follow the reference method which are being given by your institution or which is followed by your discipline. So, in this way, research proposal gives an overview to the research committee, to the readers, to the ethical committee, to the funders. What is your study? Why you want to study? What are your justification and arguments? What skills and strengths you have? Will it be useful for the community, for the patient, for the society? Is it worth funding this study? It is worth spending so much of time to do this study? What will be the methodology? How much time you will take? If you are doing 10-year study, in 10 years things will change. So nowadays, operational research, action research, transformational research which has implication in day-to-day practice is being done. So when you write a proposal, sit back and think, what study I have to do? My proposal has to be very comprehensive. Read your proposal yourself first. Analyze it, reflect back. If I am a funder, if I am a part of research committee, will I approve it? What are the strengths and weaknesses of my proposal? And when your committees give the comments, take it in a positive way. Don't think they are criticizing you. They are criticizing your research proposal so that you can strengthen it. I hope this session has given you a view what are the implications of writing a good research proposal and how to present within a limited time, because nowadays it depends. You may get 20 minutes, 15 minutes, or you may get 40 minutes. So you should be ready to present it in a concise way to convince your reader and the committee. Thank you.